Senator Bill Cassidy here, speaking to you regarding mental health in the time of COVID. I chuckle. Right now I'm quarantined. And so I actually have a sense of the isolation one feels when one is away from people whom you love because of coronavirus. But coronavirus is not unique. Coronavirus merely highlights that which we all know is to be the case. We continue to have a greater need to address issues regarding regarding mental health in our nation, and coronavirus just accentuates that. I come from this, as we all do, knowing family members or loved ones or close friends who've had mental illness, perhaps a little bit more. For over 20 years, I worked in the Louisiana public hospital system, and before that in the California public hospital system, and just saw firsthand the relationship between mental illness and homelessness, addiction, the inability to take medications, the impact upon individuals, the impact upon families. I could go on, we could all go on. We know that this is a human tragedy, but it doesn't have to be. If we can intervene, we can make it better, but more about that later. Now, I repeat that all this pre-exists, but COVID just highlights. And whether it is the social isolation, the loss of a job, being on the front lines as a healthcare provider, COVID merely accentuates that which is underlying. Indeed, someone said to me, there's those who are more fortunate and those who are less fortunate in coronavirus. I suspected they were talking about maybe money. I changed the subject, pivoted. Yes, if you're isolated, it's a tougher time. But if you are with family, no matter what your other circumstances, if you're surrounded by loved ones, then you have that support and that stability. I do think this is a time in which it is the isolation and the anxiety which is exacerbating underlying tendencies to having issues of mental health issues. Now that said, we are seeing some positive things come from this. In the effort to expand healthcare provision when people cannot come together, CMS has expanded telehealth opportunities, including mental health opportunities. And that's really good. And that's one of the things we hope will continue after the crisis resolves. But that said, there is more to do. First, I had the privilege of working with Senator Chris Murphy in 2016, Congressman Tim Murphy, and then Congresswoman Johnson from Dallas-Fort Worth area on the mental health bill of 2016. It was called the most significant reform of mental health in 30 years. I mention it now because we must continue to implement this program to see exactly how it works, what needs to be tweaked. And so as you see this implemented, give feedback to let us know, again, just how well it is going. But on the other hand, we have more to do. So I've introduced with my colleagues the Dr. Lorna Breen Healthcare Provider Protection Act to support mental health services among my fellow healthcare providers. We have heard of suicides associated with people caring for COVID patients, the constant stress, the inadequacy of resources, and yet having to care for people in which resources are in great demand. We need to support our frontline providers as they care for those and do just God's work as healthcare professionals. Now, I would like to continue to make permanent the telemental health and other telehealth services that have been put forward by CMS as temporary rules in the setting of coronavirus. Veterans continue to have issues of suicide and others. We just passed a bill in early August that expands mental health services and attempts to address suicide among veterans. One amendment that I had would ask that the Department of Defense and the VA jointly investigate suicides that occur within 6 months of separation from DOD. Is there a way there could be a warm handoff between Department of Defense and the Veterans Administration for someone who might be, from however is to be determined, thought to be at increased risk for mental health issues when he or she separates from DOD? I think this has a lot of promise and have met with veterans VA officials since, and they have already some ideas how to implement. And so I'm hoping that this can help address that spike in veteran suicide we see within the 6 months of separation from service. And lastly, the Mental Health Parity Compliance Act, which was included in the lowering the healthcare cost bill. We just need to get this across. There's been an effort to have mental health parity since before I was in Congress. We need to continue that effort so that when somebody has their physical health addressed, we can simultaneously address mental health. As we know, having poor mental health is a major predictor of early death from physical health complications. The only way to address it is to address it simultaneously. Now, where do we go from here? We have to have a partnership. We have to have the partnership where you as providers work with public policy folks, legislators, the executive branch, whatever level of government we're speaking of, federal, state, or local, to implement these policies and to change and evolve as our society evolves. I thank you for the feedback that you've given to us. Our amendment, again, asking for this warm handoff between Department of Defense and the Veterans Administration, came from knowledge folks such as you shared with us that the peak suicide rate among veterans was in that 6 months just after separation from DOD. The more we have real-time, actionable information from what is going on, whether it is in coronavirus or whether it is in part of the Veterans Administration or whether it is just the underlying issues, the more Congress can respond. So I thank you for the partnership. I thank you for your good work, and I look forward to working with you on these important issues going forward. Thank you.